Hello, this is Beth here, lead nurse educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching off-ski and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your off-ski exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam. Okay, so in this video, we're going to go through what to expect for CBT exam Part A. So Part A is your numeracy part. So you will have 30 minutes and you will have 15 questions. The average is about 2 minutes per question. Part B, you can see here, is your clinical exam, and you have 2.5 hours and 100 questions. So Part B, you will be given multiple choice, and Part A, you need to write the numbers. You need to type in your calculations. It's very important that you type it correctly because this is marked by a computer, and if you write it wrong, you will fail. Okay, so what kind of questions to expect? So measuring correct dose. So this is really straightforward. You will have 2 of these questions in your exam. And this is where you'll get like a picture of, for example, a syringe or a pot filled with medication, and it will be labeled, and you just need to say how much is in there. So the syringe will be drawn up to 2 mils, for example. So you just need to write 2 mils. Also, you need to, when you're doing the Part A, sometimes the units will be written there at the end of the question. If it's not written, you need to write the units like milligrams, mils, whatever it is, because again, the computer will be marking that. Next part is metric units. So this is going to be your conversion between units, so like micrograms to milligrams, that kind of thing. Next part is oral medications. So you probably have something similar to this in your nurse training. I certainly did, where you'll get like a prescription for a patient, and then you're going to get presented with like a picture of your medication box or bottle, and it's going to say how many tablets do you give or how many mils would you give to the patient of this liquid medication. Okay. And then the same, you're going to have another 3 questions, exactly the same, but with injections, how much mils you're going to give. Somewhere in here, the one thing you might have that's a bit tricky is going to be weighted dose questions. So for me personally, that's not something I come across often, very often at all. Like once in my career, I've had to do it. So please practice that. So that is when you're given the prescription and you have to calculate the dose of medication you give to the patient based on their weight. So look that up and practice that definitely. We will have other videos going through that. Next, you're going to have 3 questions on IV infusions. So you might be thinking, oh, it's really complicated and everything. This is really easy. In fact, I think it's the easiest part of the exam. Um, so for this, you will be given, again, a prescription, and you need to calculate, it will ask you to calculate how many mils per hour you need to set the IV pump to. So like it will be, patient is prescribed a litre of saline over 10 hours. How many mils an hour do you set the pump to? Easy, 100 mils an hour. And those ones I think were quite familiar in our practice anyway. And you will be given a calculator. So final one question would be fluid balance. So here you will be presented with a fluid chart, and it will be already populated with you, like what the patients drank, IV fluids, and the output. Okay, for this you need to calculate the input and the output, and obviously the balance, and if it's positive or negative. And you'll be given like 3 boxes to fill with your answers. Okay, so here's some tools to help you with your exam. As I mentioned, you will have a calculator. So this is how the screen will appear for you on the exam. It will be exactly like this. You can see this is quite an easy question we've got here. So calculator will be here, and you just click on it and use it. I will show you an image of the calculator in a minute. Here we've got the time remaining, and this is the flagging tool, which I think is really helpful to know about. So for this one, if you're not sure on the question, and you're trying to save time, you can just click the flagging tool and that will highlight the question for you. When you finish at the end of the exam, if you have extra time, you can go back and review those flagged questions instead of going through them all. So I'll just show you some images of these. So this is your calculator. So obviously you just need to click on that and it will work like a normal calculator. And here is your flagging tool. So you see here I've flagged question one. So for example, I wasn't quite sure on my answer for question one. So now I finished. I got like 5 minutes remaining, or 3 minutes you can see here remaining. I'm going to just click on that again and it will send me straight back to question one so I can review that, check I'm happy with it, and then move on to the other questions I have flagged.